Hello, welcome to Wellness Wednesday with Maple Tree Cancer Alliance. Whether you're newly diagnosed, undergoing treatment, or in recovery, this conversation is for you. I'm Ariel, an exercise oncology educator, and today's conversation is on optimizing your exercise intensity during chemotherapy. Stick around following our conversation for some gentle movement. The information in this video is for educational purposes only, and it's important to consult with your medical care team for more in-depth guidance and advice. Let's get started. Chemotherapy can have significant impacts on the body, leading to side effects such as fatigue, muscle weakness, nausea, neuropathy, and even cognitive changes. So these effects may vary in intensity from one person to another and often change throughout your treatment cycle. During treatment, it's important to tailor your exercise intensity to your current state of health and treatment response. So this brings me into exercise intensity, and this is what determines the effort level required to perform a movement and how hard your body is working during the physical activity. It is categorized by light, moderate, and vigorous. Light intensity exercise requires the least amount of effort and causes little to no increase in your heart rate or breathing. Some examples are walking around your house or grocery store, washing the dishes, preparing food, gentle yoga, and deep breathing. Moderate intensity is where your heart rate increases, breathing quickens without breathlessness, and your body temperature rises, causing a light sweat. Some examples are brisk walking, more than 3 miles per hour, water aerobics, light strength training, and gardening. Vigorous intensity requires maximum effort to perform. This significantly increases your heart rate, your breathing rate, and body temperature. Some examples are running, high-intensity interval training such as HIIT, heavy weightlifting, or tennis, or any other sport. And this is not a recommended intensity level to perform during active treatment. Staying at too high of exercise intensity for a sustained period of time can actually harm the immune system, and we are trying to protect the immune system during chemotherapy. There are many reasons why exercise intensity matters, but first and foremost, it ensures safety and effectiveness. Overexertion can lead to negative side effects such as worsened cancer-related fatigue, immune suppression, and increased injury risk, worsening treatment-related side effects, or even slowing recovery. High-intensity exercise can temporarily suppress immune function. Like I said before, vigorous intensity is not recommended. And some chemotherapy drugs impact heart function, and intense exercise may strain the cardiovascular system. And excess sweating and high body temperatures can lead to dehydration. Did you know that evidence shows that being consistent with 150 to 300 minutes of moderate intensity exercise can significantly reduce cancer-related fatigue, improve strength, and enhance your quality of life? Measuring exercise intensity. First, we need to know what your heart rate is, which is the number of times your heart beats per minute, reflecting how hard your heart is working to pump blood throughout your body. To monitor your heart rate, you can use a fitness tracker, such as a smartwatch, a chest strap, or a phone app that tracks your heart rate in real time. You can palpate your wrist or your neck. To palpate your wrist, you're going to place your index and your middle finger on the thumb side of the opposite wrist. You're going to count your beats for 15 seconds, then multiply by 4. So when you're palpating your wrist, if you feel 18 beats during that 15 seconds, you're going to multiply that by 4, which would be 72 beats per minute. You want to make sure that you use gentle pressure and don't use your thumb because it has its own pulse. The talk test is an easy way to check how hard you are working during exercise, and the examples on how to identify how hard you're working are below on the screen. To talk comfortable, even sing, this is light. To talk but not sing equals moderate, and barely talk, gasping for air equals vigorous activity. Target heart rate is something that we use to allow more of a personalized approach to exercise training. It is helpful with varying heart functions and fatigue levels. I'm not going to spend too much time on this, but the 3 things that you need to know are your maximum heart rate. You need to find your resting heart rate. This is best to do in the morning or after you're sitting quietly for 5 minutes. and the target heart rate zone. So the recommended is 40 to 59% of your heart rate reserve, which is max heart rate minus resting heart rate. From here, you can utilize the equation that I have on the screen to find that target heart rate zone. Perceived exertion is a self-assessment on how hard you feel your body is working based on breathing, heart rate, muscle fatigue, and overall exertion. This is a great tool to use when you don't have a heart rate monitor or you are on a beta blocker or any other medication that will affect heart rate. This scale is a modified Borg scale, 1 to 10, and this recommended exercise intensity for someone going through chemotherapy would be at that moderate activity. So you can feel like you can exercise for long periods of time, you're able to talk and even hold a conversation. Exercise intensity should be adjusted if you're feeling unusually exhausted or shortness of breath, if you're having any severe treatment-related side effects, during low white blood cell counts, if you're experiencing any muscle or joint pain that lingers, and if you're feeling wiped out for hours or a few days after you exercise. Intensity needs to be adapted to accommodate both the physical and psychological changes caused by the cancer and treatments. So when to know you're at the right intensity level. You should feel energized and stronger, not exhausted or sluggish. You can talk comfortably and hold a conversation, but not sing. You'll experience mild to moderate sweating, but you're not overheated or lightheaded. And it's expected to feel some muscle tension, but no excessive pain or discomfort. And lastly, exercise intensity during cancer treatment needs to be flexible and individualized based on energy levels, treatment side effects, and overall health status. Thank you for being part of our conversation on optimizing exercise intensity during chemotherapy. I hope the information we've covered has brought you some clarity and comfort. Your health and well-being are what matters most, so please take care of yourself, stay informed, and remember that hope is always present. Now let's transition into some gentle movement to further support your journey.
Hi, I'm Vanessa, your exercise oncology instructor with Maple Tree Cancer Alliance. Welcome to our 12-week progressive HIIT exercise program designed to increase your energy as well as your muscular strength and endurance. Throughout this program, movements will either be completed standing, using a sturdy chair for balance, or on the floor. In some instances, you may need a solid object like a broom handle or a wall. This week, you will only need a pair of dumbbells. During each exercise, remember to keep your shoulders back and engage your core the entire time. Don't hold your breath and never push to a point of pain. For each weekly workout, we will begin with 10 reps of each movement back to back, rest for 30 seconds, and then reduce by 1 rep each time until we reach 1 rep of each movement. So 10 reps the first time through, 9 reps the second time through, 8 reps the third time through, and so on until you reach 1 rep for each exercise. The following exercises are meant to be pain-free. If you experience any pain from these movements, please skip the movement or stay in a pain-free range of motion. Let's get started. Let's begin with a warm-up. So we're going to be standing up. Let's go ahead and reach up overhead. Stretch up nice and tall. Take some deep breaths. Let's go ahead and drop our right arm and we're going to lean over to the right side. Hold here for just a few seconds. Reach back up with both arms. Drop the left arm. We'll go over to the left side. Hold it here. Let's reach back up. Let's do one more time on each side. Over to the right. And back up. Reach and over to the left. All right, reaching up, let's go ahead and slowly fold forward. Legs are pretty close together. Let's touch our toes if we can. If not, you can rest on your shins. Whatever feels good. We're gonna hold here for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. Good. Let's stand back up. Good. Shake it out a little bit. We're going to do some slow high knees, so we can do hands on our hips. Just go ahead and bring your knee up nice and slow. Get your hips moving. Just do these on your own pace. If you need a chair for some balance or the wall, you can move to that space. Good. All right, I'm going to turn to the side to show you this next stretch. We're going to kick our right leg out, bend your left knee, and lean down in for the back of your leg here. Toes pointed up to the ceiling. And you can also balance on the wall here if you need to as well. Good, let's go ahead and switch. Down, left toe is pointed up, right knee is bent. Good, let's go ahead and stand back up. We're gonna do some arm swings now. Just across your body on your own. And then when you're ready, go ahead and catch that right arm across your body, palm is facing towards the ceiling. Pull it in. You should feel a good stretch in your shoulder here. Good, now let's do a big swing. Switch to the left side, palm is facing the ceiling. Good. All right, let's go ahead and switch one more time. And one more on the left side. Good. Let's do arms out to the sides. We're gonna do arm circles, forward. You can do some little ones and then make them bigger. Good, getting your shoulders warmed up. All right, now let's go backwards, little ones. Make them a little bit bigger. Good. All right, let's get our wrists stretched out. So go ahead and stick your right hand out in front of you. Fingers are pointed up towards the ceiling. We're gonna take our left hand and grab onto our fingers and pull back towards our body. We'll hold this for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And point your fingers down to the ground. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good, let's switch. Left fingers are pointed up towards the ceiling and pull back towards your body. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And point them down. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Awesome. All right, now we're going to move into the HIIT section of this workout. Like I said in the intro, we're going to do 5 different exercises. We're going to do them back to back. It'll be 10 reps the first time. Second time we go through, we'll go down to 9 reps. Third time, we'll go down to 8 reps, and we'll just knock a rep off each time until we get to just 1 rep. And after we finish all 5 of them, we'll take a 30-second break, and then we'll go through again, taking a rep off each time. So I'll show you the 5 exercises before we get started. You can use a pair of dumbbells if you would like. You can use some objects you have at home, or you can go without weight if that's how you're feeling today. The first one is going to be a suitcase squat. So we're going to have dumbbells in our hands down by our sides. Feet are going to be shoulder width apart, and we're going to squat down and stand back up with the dumbbells by our sides. The second exercise is going to be a reverse fly. So I'll turn to the side to show you. You're going to hinge at your hips. Back is going to be straight. Arms and dumbbells are going to hang down in front of you, and you're going to bring your arms out to the side, squeezing your shoulder blades in the back and bringing them down. The third exercise is a reverse lunge, and we're going to do 10 reps on each leg and then 9 reps on each leg. So you can hold your dumbbells for this if you'd like. We'll step back into a lunge, and switch, and that will be 1 rep. The 4th exercise is a Russian twist, and you could use a dumbbell for this if you wanted to, but I'm not going to. You'll just be down on your bottom. You can also do this in a chair if you don't want to get down on the ground. We're going to lean back, engage our core. You can keep heels on the ground or you can pick them up. And we're just going to do hands in front of us and twist to the side. And then the last exercise is going to be a bicep curl. So arms down by your sides, elbows are tucked in. We're going to curl up and back down. So that's all 5 exercises. And we are going to go ahead and get started. When you are ready, let's get in position for the suitcase squat. And let's begin. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good. Let's go ahead and move right into reverse flies. Arms are down in front of us. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good. Let's go into reverse lunges. You can drop the dumbbells if you need to. This is 1, 2, 3, 4, 5, 6, 7, 8, 9, one more, and 10. Good. Let's go ahead and get down on the ground for Russian twists. When you're ready, keep that core nice and engaged. I'm going to keep my heels on the ground. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good. One more exercise, and then we can take a break. 10 bicep curls. 1, 2, 3, 4, 5, 6, 7, 8, almost there, 9, and 10. Awesome. Set those dumbbells down and take a break. Get some water. Luckily, each time we're going to knock a rep off, so it should feel a little easier this time, but I think you're still going to be tired. All right. Walk around a little bit. Keep your heart rate up. We've got 5 seconds. We're going to get started again. Grab those dumbbells. And 9 reps. Ready? 1, 2, 3, 4, 5, 6, 7, 8, and 9. Awesome. Move into reverse flies for 9. 1, 2, 3, 4, 5, 6, 7, 8, and 9. Awesome. Let's move into reverse lunges. 1, 2, 3, 4, 5, 6, 7, 8, last one, and 9, awesome. Drop those dumbbells. Let's do Russian twist for 9. Lean back, keep that core tight. 1, 2, 3, 4, 5, 6, 7, 8, and 9. Awesome. Last one. Stand up for bicep curls. And 1, 2, 3, 4, 5, 6, 7, 8, and 9. Awesome. 30-second rest. Set those dumbbells down, get some water. You are doing great. We've got 8 rounds left, and that might seem like a lot, but we're cutting reps off every time, so it's gonna go by quicker every time. All right. Make sure you're getting some water. If 30 seconds isn't a long enough break for you, that is totally okay. You can pause the video. Let's go ahead and grab our dumbbells. We're gonna get back into it for 8. 1, 2, 3, 4, 5, 6, 7, and 8. Good. Reverse flies. 1, 2, 3, 4, 5, 6, 7, 8. Reverse lunges. 1, 2, 3, 4, 5, 6, 7, one more, and 8. Awesome. Down on the ground for Russian twists. All right, when you're ready, 1, 2, 3, 4, 5, 6, 7, and 8. Back up for bicep curls. 1, 2, 3, 4, 5, 6, 7, and 8. All right, another 30-second break. Shake your legs out a little bit if you need to. Walk around a little bit. Do some stretching. You're doing great. All right, 5 more seconds. Let's go ahead and get prepped with our dumbbells. We're doing 7 reps now. When you're ready, 1, 2, 3, 4, 5, 6, 7. Awesome. Reverse flies for 7. 1, 2, 3, 4, 5, 6, and 7. Awesome. Reverse lunges. 1, 2, 3, 4, 5, 6, one more on each side, and 7. Awesome. Drop down to Russian twists. All right. 1, 2, 3, 4, 5, 6, and 7. And back up for bicep curls. 1, 2, 3, 4, 5, 6, and 7. Awesome. Set those dumbbells down for your 30-second break. Make sure you're drinking some water. Wipe your sweat away if you need to. You're doing an awesome job. We're almost to the halfway point. All right, this next one is going to be 6 reps. We've got 5 seconds left, so let's go ahead and grab our dumbbells. Get ready for our suitcase squat. And let's go for 6. 1, 2, 3, 4, 5, and 6. Good. Reverse lunges for 6, or reverse flies, sorry. 1, 2, 3, 4, 5, and 6. Now reverse lunges for 6. 1, 2, 3, 4, 5, and 6. Awesome. Let's drop down for Russian twists. All right, when you're ready, 1, 2, 3, 4, 5, and 6. Awesome. Up for 6 bicep curls. And 1, 2, 3, 4, 5, and 6. Great job. Go ahead and rest for 30. All right. We are almost there. These last 5 are going to go so quick. You've got it. I believe in you. All right. Take some deep breaths. Fix your hair if you need to. We've got 5 seconds. Grab your dumbbells. Get ready for your suitcase squat. And let's go for 5. 1, 2, 3, 4, and 5. Good. Reverse flies. 1, 2, 3, 4, 5. Good. Reverse lunges. 1, 2, 3, 4, and 5. Good. Set your dumbbells down. 5 Russian twists. Lean back. 1, 2, 3, 4, and 5. Good. Back up for bicep curls. And 1, 2, 3, 4, and 5. Great job. Dumbbells down for a breather. Get some water. We've just got 4 left. And I know you're getting tired, but make sure you're keeping your form good. You don't want to rush through just because you're getting tired. We've got 5 seconds left. Grab your dumbbells. Get ready. We're doing 4 reps this time. And 1, 2, 3, and 4. Good. Switch to reverse flies. 1, 2, 3, 3, and 4. Good. Reverse lunges. 1, 2, 3, and 4. Good. Down for Russian twists. When you're ready, 1, 2, 3, and 4. Good. Back up for bicep curls. And 1, 2, 3, and 4. Awesome. Oh, I told you these last ones would just fly through. We've just got 3 more rounds left. So the next one is going to be just 3 reps of each of them. You're doing an awesome job. We are almost there. All right. We've got 5 seconds left. Go ahead and grab your dumbbells. 3 reps this time. Get ready for your suitcase squat. And 1, 2, 3. Good. Reverse flies. 1, 2, 3. Good. Reverse lunges. 1, 2, and 3. Good. Down for Russian twists. 1, 2, and 3. Good. And back up for bicep curls. 1, 2, and 3. Great job. Oh, we are almost there. So close. Enjoy this 30-second rest. Make sure you're getting your water. Don't forget. Take some deep breaths. All right. 5 seconds left. Grab your dumbbells. Get ready for your suitcase squat. We've got 2 reps this time. And 1, 2. Reverse fly. 1, 2. Reverse lunge. 1, and 2. Good. Russian twist. 1, and 2. And back up for bicep curls. 1, and 2. Oh, great job. 1 more round, and it's going to be so quick. 1 rep of each exercise. You've done so great. I'm sure you're tired. I'm sure you're sweaty, but we are so close to being done. All right. Let's go ahead and grab our dumbbells. 1 last round. Get set in your suitcase squat and down for 1. Good. 1 reverse fly. 1. Good. 1 reverse lunge. 1. Down for Russian twists. 1. And back up for bicep curls. 1. Oh, all right. You can set those dumbbells down. We are done with the hip part of this workout. Let's go ahead and move into our cool down. Let's get into a wide leg stance. Reach up nice and tall. Take some deep breaths. Good. Let's put our hands on our hips and lean back a little bit. Stretch out your back. Awesome. Let's keep our legs wide, and we're going to reach down for the ground. Touch the ground if you can. You can grab your ankles. Hold here for a few seconds. Good. Let's plant one hand on the ground. We'll do right hand on the ground. Left arm comes up and we'll twist to the left. Good. And switch. Good. Let's go ahead and stand back up. We'll do hands behind our head. Squeeze your shoulder blades together for elbow winging. Good. Release. And go back. Awesome job. Thank you so much for joining me for week 1 of this HIT program, and I will see you next week.